How can you tell if you have a worm infection, and what are the main signs and symptoms? What are the potential health risks associated with worms and parasitic diseases? What's the most effective treatment, and do home remedies like garlic or papaya seeds really work? In this video, I'll answer all of these questions. I've received many of your comments and feedback, which I've read carefully, and I'll address the most common concerns. Firstly, let me explain that worms and parasites are more common than you might think. Approximately 50% of people will encounter worms in their lifetime. You may believe you're safe by eating only well-cooked meats, but in reality, there are many ways to get infected. For instance, worms can be present in vegetables, and not all parasites come from food. Some, such as hookworms, can enter your body through the soil if you step on contaminated ground. Others, like certain waterborne parasites, can be contracted by swimming in infected ponds. I'll delve deeper into these various sources of infection in this video. But first, give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Now, let's talk about the typical symptoms of a worm infection. 3 key signs are common across most cases. The first symptom is unexplained weight loss. This can occur due to a variety of reasons: increased consumption, or even a reduced appetite. If you're losing weight without changing your exercise habits or diet, you should definitely consider the possibility of a parasitic infection. Many people jump to the conclusion that unexplained weight loss must be cancer, but in fact, parasitic infections are far more likely to be the cause. It's easy for parasites to be overlooked in medical diagnoses because the possibility of cancer or thyroid disorders often takes precedence. The second common sign is abdominal bloating. You may experience a sensation of fullness after eating only a small amount, or notice an increase in gas production. This is another key indicator that something may be amiss with your digestive system, possibly due to worms. The third sign is changes in eating habits. Some people with worms experience increased hunger and eat more, while others lose their appetite entirely. These changes depend on the type of worm and the location of the infection. It's also important to consider where you live or have traveled recently, as certain worms are more prevalent in specific regions. If you're reading from an area known for frequent worm outbreaks, let us know in the comments. This could provide further insight into your symptoms. Another common symptom is fatigue. Feeling unusually tired and sleepy, even after a good night's rest, can be a sign of a worm infestation. Worms can cause nutrient deficiencies, including low levels of essential vitamins like B1, B12, folic acid, and iron, as well as minerals. These deficiencies can contribute to fatigue, making it crucial to consider worms as a potential cause when assessing unexplained tiredness. Throughout this video, I'll emphasize that many common parasitic infections are often overlooked in favor of rarer diseases, which is why it's so important to keep worms in mind when you experience these symptoms. I hope this video helps raise awareness, so don't forget to like, subscribe, and share this important information. Let's aim for 5,000 likes to help spread the word. One of the symptoms of a potential worm infection is diarrhea, but it's also important to consider intestinal constipation, as some types of worms can cause constipation instead. In fact, any significant change in your usual bowel habits, whether it's diarrhea or constipation, should prompt you to think about the possibility of a parasitic infection. If you notice that your bowel movements have drastically changed, such as experiencing either extreme diarrhea or constipation when that's not typical for you, it could be a sign that worms are present in your system. Another sign to watch out for is anemia, which occurs because worms can lead to nutritional deficiencies that, over time, cause a depletion of essential nutrients like iron, leading to a drop in your red blood cell count. This can result in symptoms like paleness, fatigue, and even heart issues. For example, You might find yourself becoming unusually tired after simple tasks like climbing stairs, something that used to be easy. Changes in your physical fitness, like being unable to climb 4 flights of stairs when you could easily do so before, could also point to anemia. Other signs of anemia include hair loss and weak nails. Blood tests, such as a complete blood count, CBC, can help detect anemia by measuring hemoglobin levels, and one particularly useful clue in blood tests is the mean corpuscular volume, MCV, which refers to the size of red blood cells. For instance, iron deficiency anemia typically reduces the size of red blood cells, while deficiencies in vitamins like B12 or folic acid can cause them to become larger than normal. Understanding these blood test results is important in diagnosing nutritional deficiencies and recognizing worms as the underlying cause, especially if the treatments for anemia, like iron supplements, aren't effective. Sometimes it takes further investigation to understand what's causing the anemia, and worms could be the hidden culprit. Next, let's talk about specific symptoms caused by certain types of worms, which can be key clues for diagnosis and treatment. For example, jaundice, which is the yellowing of the skin and eyes, may indicate hookworm disease, while anal itching, also known as pruritus ani, could be linked to oxyoriasis. Some worms even have a pulmonary cycle, meaning they can travel through your lungs and cause symptoms like coughing, which might make you think you're dealing with a respiratory condition. It's possible to treat the wrong condition, such as assuming you have a lung issue or reflux, without addressing the underlying parasitic infection. Additionally, Ascaris worms can grow large enough to cause intestinal blockage, which can lead to serious complications. Another dangerous worm is Taenia solium, which causes neurocystic urcosis, an infection that affects the brain and can cause symptoms like confusion. This worm is commonly transmitted through undercooked or contaminated pork, but another similar type, Taenia saginata, can be found in beef. Fatty diarrhea, known as steatorrhea, can be another indicator of a Giardia infection, a parasite that causes giardiasis. In some cases, worms can also cause a condition called ascites, which involves swelling in the belly, often related to liver issues. For example, schistosomiasis, a parasitic disease caused by snails, can cause both liver problems and the ascite symptom. It's important to remember that not all worms are transmitted through food. Even if you're a vegetarian and don't eat undercooked meats, you might still be at risk, as some worms, such as those caused by freshwater snails, don't require raw food for transmission. Additionally, blood tests may reveal a condition called eosinophilia, where eosinophil levels are higher than normal, which can indicate allergies, asthma, or certain parasitic infections. Elevated eosinophils could be a sign that worms are at work. Now, let's discuss testing and treatment. One common test is a stool sample analysis, where a sample is sent to the lab to check for traces of worm eggs or worm segments. However, it's important to note that stool tests are not foolproof. In some cases, they can produce false negatives, meaning the test comes back negative even if worms are present. Studies suggest stool tests can miss as many as 50% of infections, which could delay appropriate treatment and lead to confusion. Therefore, it's often debated whether testing is necessary for everyone or if preventive treatment should be started directly. What steps should we take, given the limitations of stool parasite tests? Since stool parasite tests often have high failure rates, it's understandable to question their reliability. This is a widely debated topic in medicine. As a doctor, I adopt an approach based on a combination of a patient's symptoms, lifestyle, and location rather than solely relying on these tests. For many people, periodic deworming is a proactive measure, even in the absence of noticeable symptoms. For instance, I personally take deworming medication once a year. Why? Because I frequently eat at restaurants where I cannot control hygiene standards. Even in well-reviewed or high-end establishments, there's no guarantee of impeccable hygiene. Staff might inadvertently handle food with poor sanitary practices, or food might be undercooked, exposing you to risk. However, contamination isn't just limited to food. Worms can also spread through contact with contaminated soil or water, meaning this isn't just a regional or dietary issue. For this reason, I believe periodic treatment is a practical and preventive approach. I recommend consulting your doctor to discuss whether this is suitable for you based on your lifestyle, habits, and local risk factors. For example, people living in rural areas, particularly those working with cattle, livestock, or other potentially contaminated animals, might be advised to deworm more frequently. In some cases, experts suggest treatments every 6 months or even every 2 years, depending on the level of exposure to parasitic risks. The frequency of treatment depends on the individual's region, occupation, and lifestyle habits. Addressing the controversy around direct treatment. The approach of treating without testing is somewhat controversial. While some experts advocate for stool tests before prescribing medication, the high failure rate, with false negatives reaching up to 50%, means many doctors, including myself, prefer to skip the test for certain patients and recommend preventive treatment directly. Scientific evidence supports both approaches in different scenarios, so it's important to understand that neither is inherently right nor wrong. If your doctor recommends testing, it's not poor medical practice, it's simply another valid method of care. Medicine, after all, evolves based on evidence, and no approach is universally applicable. Common medications for treating worms. The most commonly prescribed anti-parasitic medications include albendazole, mebendazole, metronidazole, nitazoxanide, ivermectin. The choice of medication depends on the type of worm infection, the patient's medical history, and other factors. These medications are highly effective, often achieving a 90 to 99% success rate against worms. However, treatment should always be guided by a healthcare professional who can determine the right medication for your specific case. Do home remedies work? Now, let's address home remedies like papaya seeds, garlic, or pumpkin seeds, which are often promoted as natural solutions for worms. The truth is, these remedies have extremely low efficacy and are not a substitute for proper medical treatment. Eating raw garlic or papaya seeds might be popular in online videos, but there's no scientific evidence supporting their ability to kill worms effectively. For example, garlic is excellent for fighting bacteria and boosting immunity, but it's useless against worms. It doesn't reach the intestines in a way that effectively eradicates the parasites. While enjoying these foods for their health benefits is fine, relying on them to treat worms will not work. Effective medications are specifically designed to target and kill worms in the digestive system. So, don't waste time with unproven remedies. Use clinically proven treatments instead. Prevention and periodic deworming are important strategies to safeguard your health. However, always consult your doctor to develop a treatment plan tailored to your needs. Take care and stay proactive about your health. If you found this information valuable, we encourage you to give this video a thumbs up, share it with your friends and family, and subscribe to our channel, Healthy Life, for more essential health tips and potentially life-saving insights. Together, we can raise awareness and empower more people to take charge of their health. Stay informed, stay proactive, and prioritize your well-being. Thank you for being part of our community, and we look forward to sharing more with you in the next video.